safe cosmetic procedures and safe cosmetic centers, and I will also tell you something about what we are doing at our centers here. Our centers is open now since 1999, and since the time I left as obstetric gynecologist from GH in 1996, I've been doing this work. Okay, in many countries before that, because I was training for dermatology in UK, for cosmetic surgery in Australia, for anti-aging in US and in Australia. So I was all over the place. But by 1999, I already opened my first clinic. Now at the moment we have 3 clinics. This is all my list of qualifications. I'm a trainer for many different procedures and also for many different lasers, injectables, and I'm a trainer for European College of Cosmetic Medicine and Surgery. I think for the past 11 years or so, I'm senior faculty, and I teach for cosmetic medicine and surgical procedure, and I also teach on regenerative medicine, which is regarding stem cells. Yeah. So how are popular are cosmetic treatments in Malaysia? It's a top destination for medical tourism in Asia, okay? Together with India, Thailand, Singapore, and also South Korea. Of course, our Malaysia Healthcare Travel Council website is well known for showcasing seasoned aesthetic practitioners, and at one time, somewhere in early 2000s, we also been named the best anti-aging medical center for Kuala Lumpur by this board as well. So we became a hub for cosmetic treatment since the Summit of Asia Dermatology and Aesthetic Medicine, which was held the first time in KL from September 2022. Okay, so it's also aimed to show primary care dermatology, that means ada orang yang ada masalah-masalah kulit lah, and also aesthetic medicine. Yeah. It's becoming very, very popular in Malaysia, cosmetic treatments. Malaysians are becoming more conscious of importance of physical appearance. Whether we like it or not, the book is judged by the cover, as we call it. So it's also become worldwide phenomena where people are looking more at minimally invasive procedure or even non-invasive procedure compared to the full surgical procedure, macam plastic surgery procedure lah, macam tummy tuck lah, full rhinoplasty. Instead of that, people look for options which is minimally invasive, more safe, risiko yang kurang, so they are looking for procedures. So this is a trend also in Malaysia and the whole world over. Even in US, that is the trend. Yeah. So there's a lot of scary stories because when there is bad things happening, everyone will want to showcase it to help people to understand and know how. I myself have been interviewed many times when breast implants became a problem. You know, at one time the French company withdrew all the breast implants. So even at that time I was interviewed by Star newspapers, Sinchu, by, you know, a lot of newspapers interviewed me because they want to showcase to people apa yang risiko dia. So we have done a lot of work there trying to explain things to people. But still it is booming also. People know dia punya risiko, tapi still it's booming. Okay, and now because of medical tourism is from outside the country also, Ramai yang datang lah. Actually now only is a bit less, but slowly will come back. Our patients from Singapore, Hong Kong started coming back to us, UK as well, right? Yeah. So it's one of the best nations, our country, due to the low cost, but still high standard of treatments and high standards of medical care the doctors here can provide. Okay, 14 million people around the world, they will go to different country, not stay in their own country to do procedure. They go to other countries, and slowly the thing went down during the pandemic. 46.9% went down in 2020, now picking up again. And mainly travel overseas, not just for cosmetic, they also travel for medical problems also. But in a way, if you think of cosmetic treatments, is also reducing patient anxiety level, patient self-confidence or self-esteem. So sometimes it can help to elevate a lot of mental issues as well as physical issues. And also now because increased awareness among young people. So many people are now aware things can be done. So the population yang doing treatment macam ni getting younger and younger now. So we also have people in their teens, in their 20s already seek treatment, not for major change maybe, but more for their acne scar, if their skin is too dry, if their skin terlalu kusam, all these things they will still do treatments also. So let's talk about beauty, because cosmetic mean make people more beautiful, kan? So we talk about what is the definition of beauty. So many things go into beauty look. So one of the things is facial feature, skin tone, how is the skin condition, body shape, color, female body shape become very, very important. Of course, even height, and then grooming, clothing, hairstyle, all these things also. But most importantly to me, I feel beauty is about being confident. So just confident in how you are, confident in your own skin. So now it's slowly becoming a trend even in countries like Korea. It's like the no makeup look. That means the skin must be bare, but it must be flawless, So this is idea of beauty also. And our idea of beauty is come as you are and live as you wish. This is our tagline. The other tagline is for our total well-being aspect of the practice is beauty from within. So we don't just do outside beauty, we do a lot of inner beauty. And outside beauty is also connected to inner beauty, in the sense that when somebody becomes more confident, they become more generous people, they become more happy people, they are more nicer to their spouse, to their family, to their people around them, because they feel happy with themselves. So this is what we are trying to produce. At the same time, we are trying to increase their cellular health, cellular anti-aging. From the cell, how does our body start to age? It all starts from our internal cell. Outside influence, yes, can affect a bit, like sun or not, what we put on our skin, what we eat, it can affect, but our inside cells also very important. So as we age, we need to correct the internal as well as external. So we kind of balance both health and beauty like that. And then both get better, then it's very good, because we also become more health conscious because we want to be beautiful, right? So the other tagline is beauty is from within. So I was asked in the TV1 interview yesterday, can aesthetic treatments beautify women? My answer was absolutely, of course. Of course it can beautify women. But then it's also nowadays not about just being, I have scar, I want to make it better. It's not just like that. It becomes treatments instead of treatments. That means I'm already look good, but I want to make myself perfect. That's another aspect that is coming up now. That is common for any country. When everything improves, our socio-economic standard improve, our standard of living improves. People always, human beings always want to go one step further and make themselves better. If human beings, if we were not like this, we will never have new invention. We will not have the airplane. We will not have the telephone. We always wanted to be better than where we were. That is why we discovered new things. So people are also now still trying to make them tweak themselves to look better. So so natural beauty is important to produce for nowadays beauty treatments, and facial features must be balanced in Bangla, and then also not completely out of proportion. A little bit of proportion difference is acceptable, part of nature, but then most of it must be well balanced. And the skin appearance must be really good, no wrinkle, no pigmentation, especially pachi pigmentation, should not have anything sagging. So we focus a lot on drooping skin, how we can correct the drooping skin, fighting the signs of aging, which is all the things that I mentioned earlier. So what are the most popular things and easily available things in the market? Is dermabrasion, or dermabrasion is like take salt paper and rub on the skin, but microdermabrasion is a little bit more gentle. We either use diamond powder to polish the skin, or we may use diamond tips, or certain. We also do hydrofacials, which is like we are using the power of water through a very fine microjet to deep cleanse the skin and remove dead skin on the top. Of course, laser resurfacing, buat kulit baru lah, pakai laser. Okay, that is also very, very popular. Dermal fillers, I think most of us know about lah. Dermal fillers is about when we have deep folds or wrinkles or even sagging to a certain extent, we can correct with putting the fillers into specific areas of the face. Botox, chemical peels, and thread lifts is all very popular and very available methods. Of course, there's also other things. Body is also important, as we talked about. So weight management is also important. So we offer many kinds of weight management programs here, going from medical weight management, going to injections into very stubborn fat areas. For those with a lot of fat to remove and the body, they want it to be perfect. We also use methods of liposuctions like Vaser or laser. And for body, it's very complex because sometimes we can remove the fat, but the fat can come back, right? So we also look at internal factors. How is their diet? How is their activity? How is their hormone condition? How is their liver? What is the nutritional deficiency? When we say malnutrition, many people think only people yang kurus kering and lembe-lembe dia yang ada malnutrition. Is actually wrong. People who are big is also malnutrition because they are not eating certain important food groups that bagi body dia lebih cerdas lah. So you cannot burn fat in that way. Ataupun dia ada pre-diabetes or insulin resistance, that kind of conditions. So our job is to diagnose and counsel on all these things before choosing the right kind of treatment methods for them. Okay, and of course, why skin tag? Okay. Okay, how to choose a safe aesthetic treatments? Okay, any part of the body you can also do all these treatments, right? Botox can be done for the face, it can be done for the neck, it can even be done. Nowadays there's a lot of people looking to make their shoulder look smaller. They do Botox here. They want their calves, their thighs to look smaller. They do. Yes. Yeah. We've been doing for a long time a bit of breast lift using Botox injections. It's possible to do. Tapi is more complex procedures, needs special training. So senior doctors like me, we are not going to go out and easily teach these things lah, because it's very complex, and we are using larger amounts of Botox. Botox is a medication, yeah, it comes under poison. So we do not want to teach things that involve big amounts if people don't know how to control. So that's the reason it's not popularly known outside, but it's all available and it's all being done all over the place. Of course, you all know Botox also has its medical uses, right? It's used for spasticity, cerebral palsy, when multiple sclerosis, I have patients who have multiple sclerosis, we do regularly Botox for them to relax their body, their legs, so their movements is better. So there's a lot of different reasons Botox is used for. Similar thing, fillers are also used for many areas, Is there a deep scar or is there a shape problem in the calf? We can also correct it by doing fillers. Then again, it's huge volumes of fillers use. So it's also something we need to condition, need very special training and method to use that also. So we give not just the basic treatments, we also do more advanced treatments. We also offer different options. I have always said in a lot of my talks, and this is my very firm ideology, is that somebody who is doing a cosmetic treatment center, they cannot know just to do one thing. Because not everyone will fit into that treatment parameter. Sometimes patient perlu ada different modality atau dia ada choice. Most of my Muslim patients, maybe they're takut about Botox, they won't do Botox. So I have to have the energy-based devices, treatments like thermage, treatment like photona, which can reduce the lines without having to inject any Botox inside. So I have to provide different methods. There is somebody who will say, I don't want, if I want a skin tightening, I want the result to be kekal, long time. We cannot do a laser treatment for them because laser or energy can last about 1 year to 2 years, that's all. So I need to also have some like thread lifts la, some small face lifts la, that kind of procedure options I also have to give. So the amount of training, the amount of technology and the kind of staff, everything becomes more specialized. We will come to that later when we come to how people should choose the best cosmetic centers. I think the problem nowadays is happening also is because many of them just train in 1 or 2 things and then they cepat-cepat open. And then when problem happen, they are not properly trained, then get into trouble. That is why recently there's so many complaints against cosmetic clinics. Minister said there's more than 103 complaints about cosmetic clinics. They're just this year itself. Belum habis lagi 1 tahun. So it's because people are not fully training themselves, they are too fast to just open and do something. So unless you have a full option of many different things, you can't give the best result to the patient. You tak boleh bagi apa yang patient betul-betul nak. And then the understanding, the experience is also important. Sometimes we need to listen to a patient to understand apa yang dia nak kan. So sometimes in many center is also not doctor who will do the consultation, is also a beautician or a frontliner yang bagi consultation. This is also a wrong thing because then there's no understanding between what the patient is doing and the doctor is doing. So this is just to show a difference between, for wrinkle we use Botox, okay, filler is for volume, for filling up, so it's not the same. So many times in interviews I'm asked, why is Botox giving swollen look to the face? Do you all have that question? I can see many of you nodding. Actually it's not Botox, huh?
Oh, it's filler, right?
It's filler. And sometimes the keras look on the filler face is not from a good filler. It is from some of those cheap silicone oil. There is some wonder gel, something from China. There's all this kind of product tiruan, you know. So this I hope not the doctors are not doing lah, you know, maybe beautician atau people posing as doctors. There's many posing now as doctors. They are not doctors, but they have a doctor name in front and they pose as doctors. So they actually cheating the public lah into thinking. So that's why we will come to the part where people should be very careful about how they choose the doctor also, not just the center, even the doctor. Yeah. So different type of aesthetic centers available now. Okay, that's confusion. So which one should people go to? Which one ada license? Which one tak ada license? Which doctor akan buat satu procedure? All these are confusion. So many times because there is no practicing license, people are very brave. beautician or doctor's assistant who fight in a clinic and go out and they try to say, I know. But we don't train people who are unqualified to do procedures. Maybe we train them to assist us, to clean the face, all that. But we don't train them to. Doesn't mean you are a doctor's clinical assistant. You have the license to practice outside on your own. But all this is happening. So people are very confused right now.
Ya, dengan pakai scrubs lagi doktor. Pakai
Scrubs dia pakai. Yeah, it's just like how nowadays pharmacists wear white coat and then they will tell people what medicine to take. Pharmacists are not supposed to prescribe medicine. They can give out medicine yang doctor prescribe.
Bagi surat tu kan.
Yes, dengan surat. But you see the pharmacists now, they will do a blood test and they will tell you what medicine to makan for diabetes. It's all wrong things lah. Is because we very fast advance already. So this is why there's a lot of confusion. Okay, what are the risks? Every cosmetic treatment will have a risk. Okay, even if it's a skincare saja. How many of us have experienced we use a skincare thinking it's okay, packaging is all beautiful, but we use it only keluar allergy, keluar merah atau kulit, all peeling off or breakout, all this. We see this every day in our practice, people using the wrong skincare also. So risiko is always there. Injury to the skin when we are doing injections, even the smallest injection, it can also cause infection. So hence the reason to have very clean premises. So my thinking is people should go in and check the place out before they will decide whether they want to do any injection treatment there or not. Of course, if we have a good practitioner there, any risk that can happen. We inject something in clean premise, tapi patient pergi keluar and then ada satu dot sana, dia punya kawan pergi sentuh-sentuh, hey, what happened here? Go and touch there, the hand is unclean, infection can happen. But if you have a good doctor, you go back to the doctor and say, doctor, this area got swollen. The doctor will prescribe antibiotic cream or antibiotic, finish the problem. Okay? But if you don't have a doctor there, if you go back, I've heard this many times from patients, I'm not making it up, okay? They go with a burn after a laser which was done by an unqualified beautician, okay? And they went back with bubbles of burn all over the place. And the lady told the patient, oh, it will get better in time, nothing. So it got infected. By the time patient came to me, 1-2 bulan lepas infection, sudah ada paru yang deep. And dia kena buat treatment yang, very, very advanced treatment to correct all the problem. So sometimes you must make sure that there is doctors there. You must make sure the doctor has the poison license to give you the proper resolution. Because antibiotic tidak dijual untuk people yang tidak sah, isn't it? So you need to have the doctor, trustworthy doctor who is available to attend to you. This is another problem when things are done by so-called doctors in houses. Right? They did, then they completely ran off already. They went back to their country or whatever. When patient had a complication, went back, nobody to deal for it. See, this is another problem. Another problem why doctors should be involved is because ada certain special conditions. Maybe orang ada kencing manis, maybe orang ada darah tinggi, maybe orang makan ubat yang cecairkan darah. Then all these special conditions we will take into account and we will advise patient as to how we can do a safe treatment for them. And we already prepared. Kalau dia disclose to us, we already know how to deal with everything there for them. So if people don't say, also is a problem lah. Smoker, for example, people drinking a lot, all this obstruct blood vessel, healing akan lambat sikit, inflammasi boleh jadi. So all these things they have to say, inform to the doctor also. Kalau dia bukan doktor, dia takkan faham apa-apa. They will say, oh, okay. You will be cantik. That's all they will say. Because they are just nak bagi something, what? menjijikan. Give like extreme, idea of your beauty. So this is hoodwinking people also, just cheating people lah without
Setting high
understanding.
expectations. Setting high expectations. for the
Setting
patient.
very high expectation to the patient. So many time is unrealistic expectation. If somebody very very condo come to me and say, doctor, you do a filler for me or a botox for me, I want to look younger, I will tell them you can only improve from here to here because it's very far gone, right? So we have to, if you are in baby class, I will tell them you need to go to primary and then secondary, ada tahap-tahap. So we give a treatment plan to patient. Doesn't mean they cannot do because budget small, tapi dia mesti kena ada treatment plan. But if you go to unqualified people, they are going to say, just do this, you will like magic become beautiful, so this is unrealistic expectation lah, just to explain. So these are all things went bad. Wrong doctors, wrong procedures, maybe bukan doctors, I don't know, because most of them are overseas, we don't want to show anybody local. Okay. So dermal fillers are also can cause a lot of complication, yeah. So we will always tell people that it doesn't mean filler means it's very simple. How is everything happening? We will show, I have shown for, I don't know, Nona ka Vanita Harini, on the spot in the studio, I inject filler. Maybe 10 beautician watch that, they think, oh, I also can take a needle, I can poke it into the patient face and feel it, it'll be okay. But then they don't know the risiko. Watching a procedure and learning step by step everything about a procedure is two different things. That is why you need the doctor's background. Why? Because we teach facial anatomy first. You must know anatomy. If you don't know, you go and inject here, very dangerous part. This whole side of the nose can mati. Yeah. Urat saraf boleh rosak. Because you don't know the anatomy, you're injecting in the wrong place. Botox pun sama. And then again, if you go to an unqualified person lagi, all these items are all good items. Good dermal fillers, Botox, Xeomin, all are registered items. They will not sell to non-doctor. They will not sell. So when you go to a beautician, what are you getting? Some product tiruan. So that can cause your urat saraf to mati. With Botox, it will never be a permanent change. It won't happen. It will come back. Even if this thing drop, it will come back in 3 or 4 months. Okay? But if it is done by a China Tox or one of those other tox, there's a lot in the market nowadays, then it will be permanent damage. Because the chemical is wrong already. And the injection technique lagi wrong. So nose is a dangerous area, eye is a dangerous area, corners of the mouth, corners of the nose, all are dangerous areas for dermal fillers. So the faces we showed earlier, even it's done in the cheek also because dia punya tahap terbetul, cara injection terbetul jadi kondo like that, right? So the one is also, even though it's not dangerous area, but it can give a bad look to the face if not properly done also. I'm saying it from the fact that many people will come to me when they have problem like that, and I have to correct it for them. Okay. Why they went to the other place? Because they will say cheap. We are not expensive. We are not the most expensive in the market, but we have to charge a reasonable price for our good product and for our good service, you see. So this is how things work. But we are not the most expensive. So people should not just look at cheapest is best. Yeah, this is very important for that. Everybody must do their kajian sendirilah. This is very important. Find out who are the good doctors, how many years experience, what is the kind of comment about them, in the internet, social media, all these things are important. So that is why KKM from 2000 and 2014, 15, came up with a license to practice cosmetic medicine. So that one, everybody need to have the license. Dear surgeon ke tidak, dear doctor ke tidak, and but not nobody else, non-doctors are not given this license. I mean, that is ministry's preference lah. So nurses lah, beautician lah, therapist lah, clinic assistant lah, atau doctor yang lain, general practitioner, they're not allowed, license to do these procedures. So people, when they are looking online also, they need to make sure that they find these doctors who are in the LCP registers. Yeah. So they are already starting. Now we have maybe about 200, 300 doctors with LCP license to practice. So they can look for these doctors. Of course, the other thing is also the centers. Okay, the centers, sometimes you look at chain clinics, maybe 1 doctor, 2 doctor got LCP. The rest of the 20 clinics, tak ada doctor yang ada license. So they will just have somebody there as person in charge, but the doctor may be not around there, or somebody else doing the treatment. I don't know. I don't run chain clinics, so I don't know. But I only know from what I hear from other people lah. And then even the equipment also, they will advertise for one equipment, but the equipment is very expensive, like $500,000. But kalau diorang ada 20 clinic, how can they afford to put $500,000 treatment? Is not possible. So advertisement is one, but when you go there, the machine is another. So if you all are writing about it, also advise consumer, you have the right to go in and check for the equipment. Ask the doctor for the license. Ask to see the clinic license. Ask to see the annual practicing certificate of the doctor. Annual practicing certificate means you are a doctor, practicing doctor. If you have anything major against you, Ministry of Health won't give you the practicing certificate license already. It's a yearly renewal, yeah? So people have the right to ask for all these things. I have overseas patients who come in for very specialized treatments. They don't know me, dia tidak kenal saya, tapi they are coming in because they heard that we put out some news about that particular procedure. They will ask to see the machine. I'm okay to show, I'm transparent. When I do filler, I can show the product to the patient. When I do something on a patient's face, what I'm injecting, I'm willing to show. But most of them yang ada complication datang sini, bila saya tanya apa produk yang kena inject, your muka atau your badan, dia tak tahu. Because it's all hidden from them. So our consumer have to learn to be more open. If they want to kurang dia punya risiko, they have to ask, what is it you are injecting into me? Can I take a picture of the product? So later, if any problem also, you can always, know what was injected. So this is important also. So steps to becoming specialist, I don't think it is so important, but anyway, you must have a basic doctor qualification. You must be minimum at least 3 years practiced as a general practitioner, and then you must have another 3 years of experience and training under somebody who has the license to practice, and they will of course have supervision and attachment forms and all those things the ministry will require. Bachelor's degree in aesthetic, we hope it's coming, but so far we don't have. But for European College of Cosmetic Medicine, we are coming up with a fellowship program for doctors who do complete a lot of courses, both basic and advanced courses. So this is the same thing I talked about. Okay, realistic expectations we've already talked about. So medical specialists, surgical specialists, non-specialists all can do, provided they have the LCP license. Yeah. Okay. But other things to look at, most important 5 things to look at. You have to look at the doctor's experience, latar belakang doktor tu. And also look at the clinic staff experience. Okay, if doktor tu baru belum buat banyak, dia punya staff pun tak tahu banyak. So then you know already. If you call a clinic and then the person is always saying, oh, I don't know lah, then you already know dia tak cukup pengalaman. So look at clinic experience, staff experience. Realistic treatment plan is important. Tak boleh, jangan go for the one who say, oh, you said I pay 1,000, you can only give me this. The other clinics say for 1,000 can make my face perfect. Which one is realistic, which one is not? Right? So you have to go for realistic rather than people just tipu you something. Check out the feedbacks and reviews. Okay, consider the price range, very important also. Most expensive does not mean the best. Most cheap does not mean the best either. It has to be choose. Everything is available in the net now. You roughly know what is the price of each thing. So if somebody is offering you very cheap, you also know it's a wrong product. If somebody is offering you too high for that particular product, you also know it's a wrong kind of service. So then you cannot go for that. And you must also see another important thing which my PA, Shireen, has told me about. I am not very much into social media, but she tells me that many of the before, after in the social media is doctored. That means they had filters done. So just be careful lah. So this is why Ministry of Health actually has a ruling that says, especially in our websites, you cannot put before and afters. So people also can go into websites to look and make sure they check for the KKLIU license. Okay, KKLIU is the medical ubar punya board kan. They must give permission for putting a website, because if it is under their surveillance, they will make sure that no before after pictures or funny kind of price discounts all will not be there. They are very strict about that. So people can also go in and check for KKLIU, because I also heard from Shireen that people open website tapi dia tidak sah. I didn't know. I thought people open website only if they are genuine, but actually no, she said. So look for KKLIU lah, will be the best. Okay, any form of cosmetic treatment or surgery you nak buat, you think twice. Don't just go in and straight away jump in and do the treatment. If anybody is pushing you, do it today. You know, I'm going to give you this special price. People should not go for it, honestly, because something wrong there. Yeah, we can say that, okay, we have a special promo, but we don't have to force the person to do it. They can still go back and think about it and decide for themselves. That must be the correct way. Of course, they had to have a proper consultation. Our experience most of the time is people call for price only. Dia tertanya apa produk yang doktor guna, siapa doktor yang buat treatment tu, buat ke mana, tu semua dia tertanya. Soalan dia hanya price saja. So this is the wrong way, you know. So if you want a medical treatment, you have to come for consultation. It's just like your heart or your urat saraf problem or anything, you know, is also something we want to do properly, professionally. So you must be willing to walk in and see the doctor. Wait for the doctor if necessary, you know. So it's important to do that, and don't argue about pricing lah. Ada orang juga argue why we must pay consultation. I bring my pet to the veterinary service also, I'm paying 100 ringgit, okay, for consultation. But human being tanah bayar consultation, because they are saying there are other places not charging consultation. Then we normally say other places is not doctors consulting, it's a beautician consulting. It's different, you know. Those are consultant and they are paid just to do the consultation. They are not professional. Kalau doctor ambil dia punya time to do consultation, you must be ready to pay for it. It's a basic respect professional charge that you pay. But you will get everything back in good treatments, less complication, everything. So of course we say be your own expert in the sense that you have to buat keputusan sendiri lah, bukan bagi lain orang buat. keputusan for you. So the problem nowadays is sometimes there's a lot of agent pula. So the agent will say, oh, you go there, it will become very beautiful and all those things. I have my patient sendiri yang buat dengan saya, tapi dia buat agent for other clinic or other company pun ada. But what they are saying is not true. Yeah. Yes, correct. Yes, because they are getting money, you see. So they will just, it's like a job for them. So they will know. That's why we say patient must take their punya own decision. They cannot depend on others to do decision. Walaupun they appear like their best friend, they will be very kamcheng with you, you know. They'll be very nice to you, you know, and then slowly push you to do treatment and get on and off. We have offer also people like that asking, can I be an agent for you? We say we don't practice that because agent will give unrealistic expectation to patient. And then when they come in here, when we tell them the truth, they may be disappointed. This is our worry. So we don't do that kind of thing. But people must be aware of that lah. So you must be comfortable with the clinic you have chosen also. You must have realistic expectation and be willing to accept. Kalau you dah choose your doctor, you're comfortable with, you're sure their qualification, everything is okay for your expectation, then you have to also listen to them. So if we say this result will last this long, we are telling the truth. You cannot be duped or cheated by another person who give you unrealistic expectation. So when you find a properly trained clinician, the environment will be right, and then you also will know how to prepare for surgery. We here will give a list of preparation for every procedure. We will give a list. So they will know how to prepare for surgery. Roughly, they also will know what will happen during surgery, how long recovery, apa yang risiko, side effect kalau ada, dia akan tahu. Aftercare, we will also tell the aftercare, which one is chargeable. Kalau kita buat surgical, maybe buka jahit tu kita bagi free. Not every clinic is the same. Some medical center, they charge for the removal. But kalau our policy is free, we will tell them free beforehand. But if you come frequently just to see, then maybe you will be charged for something. Realistic lah, we will tell everything upfront. That's what I mean to say. And then you do your proper due diligence, and you will not become stressed because of a cosmetic procedure. It must improve your self-esteem and confidence, not make you feel more sad. Ayah kena tipu lah, you know, not like that. Then it's not good for you. Okay, even skincare is not safe. I think I'm going to stop right here because after this I have some list of our treatments that we offer. So because the time is also short, and then maybe we give too much information one go, it's difficult also, too much overload. So we will open for you for some questions. If you all need more information about skincare, I produce a lot of skincare, all safe plant origin. We have internal healthcare products, which is JAKIM certified. It's all pure plant-based products with collagen, everything added in. We have whole lot of shampoo for hair loss, conditioner, tonic. We have female well-being washes, vaginal tightening products, whitening the area products. We have whole body slimming for improved collagen, for bust well-being for women. We have a lot of things. So if you are interested in any one of them, you need more information, you can approach Shireen, and she will send you all the information. I think that will be better, right? Rather than I go through, because we have a lot. Okay, so
your produk ni jual di mana? Di sini saja ataupun kan selalu Shopee ke mana-mana, jual di mana?
No, we just do in our center because our products are plant-based, I said. So our way of doing is small lots, 100% fresh we do in US. So we don't put many chemicals inside. So for that reason, we cannot put it in Shopee and all that. Kalau product to expire, then we will have to take it all back at our own cost. So we don't do it in Shopee. We don't do it in, yeah.
Betul. Kalau macam ada patient ni, public kan, dia first dia buat maybe dia buat the from satu doktor yang delegate lah. So tapi bila dia tengok result, oh lambat lah, I dah pay the certain amount, kenapa lambat, I nak cepat, I nak fast result. So from dia tak habis treatment lagi, then dia dah pergi ke another clinic, but another clinic is not clinic from doktor lah, this beautician. So the result is maybe hidung jadi teruk ke, muka jadi teruk kan. And then dia saman klinik yang first tadi tu. So mungkin pandangan doktor, sebab ada pernah I cover lah this case ni. So mungkin daripada segi pandangan doktor, it's not macam kita sekali buat bukannya terus dapat fast result ke apa ke kan. So mungkin mindset orang.
Yeah, this is the reason kalau kita buat treatments like untuk parut for example, atau kita buat laser untuk pigmentation, melasma, kita memang akan bagi tahu patient dia punya number of treatment. And then kalau macam earlier I discussed, if the face is very loose, kita ada different tahap-tahap treatment sampai dia dapat full result. So we also write out the treatment plan and then bagi costing for each one also. So this one is a contract the patient need to sign on. Okay, so if the patient just putuskan contract and then they go somewhere, they have the first clinic got no legal liability, kan? Because dah bagi tahu dia. Kalau kita tak bagi tahu, it's a problem. Because if we didn't tell the patient, you will need for treatment to clear this problem. Because of cost issue, it happened to us a lot. Many of our patients will say, oh, I cannot pay for 4 treatment, say for example laser, I only will do 1. But we still have to put there 4 treatments is necessary or 6 treatment is necessary, and we have to get them to sign. Listening to me? Because I have some new stuff, so it's also teaching them. Yeah. So, but it's very wrong for somebody to already choose a doctor yang legit and tada bagi dia chance. Because certain thing cannot be short term achieved, right? So it's not possible to give that result, but communication is important. The one maybe is a problem. So sometime in busy clinic, maybe communication get broken somewhere. So patient tak faham juga. So patient tak faham pun kita mesti open door to bagi dia come back and talk to us. It's better that way. So I always give instruction to my patient. If patient is saying something, okay, we just tell the basic things first. Puan, your treatment is 4 treatment, bukan 1. So you takkan nampak semua result. So you need to come for the 2nd, 3rd and 4th. Then we will take the after picture and we compare, we show. Nobody will say, I cannot see the result. At least for us lah. We always show result. But if we did not tell them that they need 4 treatment, or kita tak ingat, sometimes patient lupa juga, ada juga case patient lupa. So then we need to give them information again. So I will tell my staff, you bring them again to see me. So I kasih ingat dia lagi what we discussed in the first time. So it's normally in the clinical notes also. So it's difficult, but if they just go halfway through to go somewhere else and then put the blame on the first doctor, it sound to me like, I don't know what really happened. It sound to me like some anger issue with the first doctor. They marah the first doctor for something because dia punya complication happened with the second non-medical place. So how can they blame the first doctor? This is another issue which is coming forward, right? It's because they go to a person tidak sah. So dia tak boleh sue itu orang. So they can only go back to the legit person to get back something. So I think these are all the reasons lah. So I have news of people, they have told me, some of my patients, where the beautician is telling a patient, okay, I done that, you came to me, I done that for you, now you got a complication, what do you want to do? You want to sue me? Go, sue me. Because they cannot. Because they are not professional. The judge akan pusing balik and say, why other doctor, why you go to the beautician for? Yeah, you know already open to your face and your body to complication. So maybe that's the reason she put the blame on the first doctor to try and get back some of her losses lah. I feel like that. But I'm not 100% qualified to answer because I don't really know the full circumstance lah. Yeah, I'm just guessing.
Oh, but the product, you know, sekarang kalau kita tengok lambakan produk skincare dekat Malaysia contohnya kan, from OEM factory kan, kalau kita tengok semua yang diiklankan ada not KKM numbers approval, tapi kalau kita selidik sebenarnya not KKM tu bukan menunjukkan yang produk tu adalah bagus dari segi kandungan sebagainya kan, dia just approval untuk pengeluaran produk tu kan. Dan sekarang ni kalau kita lihat dari segi pengeluaran produk pun, the KKM numbers tu adalah bukan dari produk tapi daripada OEM company, factory tu. So mungkin pandangan doktor lah untuk remind pada public yang pentingnya pemilihan produk yang bagus dari segi mana produk, lambakan produk tu tidak hanya bukan pada not KKM number saja. So kena tahu the ingredients, bukan timbang kilo punya produk.
The one susah sikit lah. Lesson tu keluar just after dia orang timbang rasa tengok ada any racunan ke tidak, ada produk yang tidak sah, because now APEC area, ASEAN area, our restriction on many of the product is very strict, even more stricter than Western country. Is very strict. So at least that part they have taken care. That means dia dah check tak ada benda yang boleh rosakkan badan atau kulit. Is already they have checked it. But efficiency, how efficient the product is, that one, this is where we said is not just look at the lesson is the basic lesson is basic. Next one, where is the product coming from? Who is supplying the product? Is it Dr. Alice, or is it somebody who's completely not in this line and then suddenly come out with a product? Dia sendiri tak tahu tentang produk. Then how they going to come out with the best product? I come out every product, I done lot of research. It take me couple of years before I come out with one product. Because I do a lot of research, I look at everything around there. I see whether my product will make a difference to people or not, whether my product ingredient is more better than something around or not. Because like just now Puan tanya, kita bukan distribute dekat supermarket atau pharmacy atau Shopee atau Lazada. We are from specific in our center, so we want to keep the good name. So I will make sure of all these things. So people now, we know that every celebrity yang ada on Instagram famous pun, they come out with their own product line. Dia sendiri tak tahu tentang skincare. Dia bukan orang sains. You know, so how they going to choose the best product? Maybe somebody tell them that this product got good profit margin. Whitening product, you can promote easily, mesti ramai nak beli. Slimming product, maybe ramai nak beli. This is how they choose the product. So you must see where the product is coming from. Is it from a good background, latar belakang, you know? Then it will have better quality inside. Third thing is you learn to read labels. All my skincare talk, I talk about this. You must read label. You must find out what is the list of ingredient inside. Because sometimes ada ingredient tidak sesuai for our climate. Walaupun coming from good company, tidak sesuai. Because we have pigmentation in the skin and we have bright sun outside most of the days throughout the year. So maybe too much retinol, too much acid, tidak sesuai for our climate. Too much of oil, too much of allantoin, too much of any of the moisturizing ingredient. Maybe tidak sesuai. Because why? Our humidity is very high. You cannot get a Korean product, use it here and expect the best result. Because Korea is a dry country, cold most of the time. People have different skin type. People are very fair, they are Mongolian skin type. They are very fair, less pigment, thicker skin. Kita ada buat kajian on different skin texture. And Korean have and Mongolian have the most thick skin dermis in the world. Compared to all of us, we have thinner skin. So we cannot take the damage of their peeling product. Half my patient come with redness on the skin is because they bought all these product online or from shopping mall or supermarket. So they injured their skin because they think because Korean it will be good. But Korean made themselves beautiful by doing a lot of cosmetic surgery on themselves. So if you are not willing to do that much of surgery to perfection, you cannot expect to look exactly like that. So we have to work within our demographic. We all have color in the skin. How we keep our skin tone all balanced, same color. How we lawan, penuhan. How we can buat treatment yang boleh bagi. Our face shape stable, our skin stable. These are the best practices to think of, not to copy and take product from another country. But all this we saw patients who use peeling product, Korean product, and this is a beautician, I Tatibu, she's practicing in Subang, this beautician. She's fair skin also, not very dark, she's Filipino, okay. And she used this Korean product. In a month, her face become like a very dark color. Whole face burn. Because the skin texture is different. Tak boleh tahan insult as much as the Korean skin can. So the product may be famous there, but not sesuai for us. So my suggestion would be you look towards local people. Local leaders yang ada pengalaman treat many type of skin type, like for me, I'm laser certified, okay, I'm board certified for laser medicine and surgery. Even though I'm certified, I still do specialist course for lasers on colored skin. This is another one because laser bukan senang pakai on people with color on the skin. But we can still use, but we need to have the special training and experience to do that. So you had to search for doctors who can give that and who respect our special condition here, our special climate, our humidity, our sun, our skin type. Then we produce skin cares depending on what our demographic need. This will be a better option to do. You see, good things cannot be easily always available. But we also make it easy for people, Puan, to answer your question. Anyone need product, just call us. We do free delivery for them. No, really we do.
What about this trend with the ordinary product? No beauty explanation or doctor consultation, but they do it by themselves by reviewing from Google. Use retinol this amount, 0%. What do you think about that product, the ordinary?
That's the brand itself,
Yeah,
right?
Ordinary.
It's the brand.
Ordinary, the
one-
brand.
Yeah, that
Brand one.
So they help you to mix and match things, right?
Yeah.
If you really know your skin that well, you done Chuko Kajan, maybe it's possible.
So hebat.
But even just now morning, I did a consultation on a patient, and the patient said, I'm so fed up of all the treatment on my skin, and my skin is still breaking out, so I'm going to use retinol. And I was like, wow, no, your skin is already so red and so nippies. You cannot use retinol. You know what retinol does?
Oh, seriously? Because I saw it TikTok. Oh, Malaysian people mesti kena guna retinol yang tinggi untuk kulit nampak cantik, cerah.
You go and Google, don't take my word for it, go and Google complication of retinoic acid.
So,
It can make your skin originally look a bit shining because it's peeling the top layers. And it's also reducing the thickening of your skin by cutting down on cell turnover. So it will make the skin look shining because the top layer is a protective layer. But God willing, this top layer is a protective layer, but they are rough sikit. They are rough sikit. So it will give the thick, nice look to the skin, but not the thin, shining look to the skin. When people do that all the time, continuously, it will burn the skin, and on top of the burning of the skin, it also makes your skin become like old person skin. Hyperpigmentation, kulit like leather, you know, like kulit lembu lah, like that. You know, it become thick and cannot be conditioned after that. So it's not a good thing. Retinol has its indication. So retinol pun ada control dengan Ministry of Health. Only doctors can prescribe retinol. Dalam 1% saja, bukan any percentage. We also cannot just prescribe. Similarly, hydroquinone. We can also prescribe hydroquinone for a short period of time, but we have to be less than 4% and we have to see the indication. And these are not things we are selling over the counter. We don't put it as the Alice brand, buy it. It's a clinical treatment. It's only prescribed by doctor and it's only given on indication. Because when hydroquinone is used continuously, it causes a very bad condition, okay, which will make the skin permanently dark.
Permanently dark.
Yeah.
Doktor, antara Malaysia, Thailand, Korea, adakah kita punya, kalau kita nak bedah hidung ke kosmetik, kita nak buat kosmetik, tak perlu pergi sana? Kita sama standard dengan dia orang ke?
Of course.
So tak perlu lah
We
macam
are, we
London
are better
Rodin.
standard than them.
Tak perlu pergi Korea ya nak buat hidung.
Dari segi
Malaysia
harga,
patut lah Malaysia.
Harga is something people think is cheap. But if you calculate everything, your flight, your, like
Hotel.
just now I outlined, every cosmetic procedure ada chance, ada risiko. Okay? So then you have to go back there. That's the time patient will come to us. And they will say, oh, I did the procedure there, but now I'm having this problem. I say, then you can go back. Oh, you know how much it will cost me to go back? I have to go and stay there. And the doctor won't do the correction for free, you know. I have to pay again, you know. So they'll tell, I say, you must calculate everything before you go.
What do you think about thread? Nowadays, people like love to use thread.
Our favorite topic. People like to use thread for what one?
For sagging face, lepas tu for mostly for sagging face actually. We wanted to look young, and then I don't know whether it's good or not because some of them like taking about more than 40 or 60 over thread on the face just to make it.
It's a very good question, but it will have a very long answer. You all ready or not?
Make it short.
Make it shorter. Okay. When they put 40 to 60 is not good thread. It's not good thread. This we call as monofilament thread. Is made from polydioxanone. Okay, PDO we call it. And it's so fine, it doesn't actually give any supporting effect or anything. No lifting. Sometimes people see some immediate result is from bengkak. Really. When somebody's face is bengkak, it look lifted. So people thought that there was result, but actually there is no result at all. And number 2, it will cause a lot of complication. We call it type 1 fibrosis. I ada pernah buka muka and ambil keluar benda tu semua. The product hilang dalam 1 bulan, tapi dia form, the skin is trying to react to the wrong product by producing a lot of fibrosis. Dia jadi putih-putih tissue, very thick tissue which is stuck all over the face, and then sometime they will make the face something like what you saw lah, the celebrity and did wrong thing, that kind of face look. So it's quite bad. But if you use good threads, proper material, and with surgical method of lifting and anchoring, then it is a good option for people who have sagging but they're not ready to do a full surgery. It's a good option for anti-P1. But most of the people, especially unqualified people or untrained people doing, is all this 40 to 100. And people think just because they are getting 100 thread for 3,000 is such a big deal. But they are causing so much of harm to themselves. Dia macam ambil problem, bayar 3,000 like that. It's not the correct thing to do. So again, thread is something good, but the material has to be good, done by qualified people, because there are cases of threads come out with pus for the whole areas treated. It can happen. So it again has to be done with qualified people lah, so that even if it were to happen, we know how to correct it. It happened to me also. People go and do facial on a thread lift face and then come out with a huge hematoma, blood clot. Because it's me, I extract the blood clot, treat the patient with antibiotic, the problem went away. If you do with an unqualified person, the person just tell you it will go away by itself. I have patients come into my clinic, pus leaking from their body all over, because the beautician who did it, when they had a complication, told them it will go away by itself. Just be patient, it will go away. So it's not right to do these procedures with unqualified people also. And also to answer your question about Korea and all that, I have a head of plastic surgery, is a close friend of mine in Korea, and he told me that the people who are giving cheap prices, they work like a syndicate. The senior doctors will give their before after picture to promote, and the people who are doing are all just people who are learning. And he told me none of our Korean lady will go to these doctors. They are the ones who are offering cheap prices. Okay, if you go to really qualified people with good experience, like my stature, they are 3 or 4 times more expensive than me. They are very expensive because they charge also in US dollar. Good doctors lah, but there are trainee doctors who with no experience, they are working in a syndicate to just bring in more revenue. Korea is a country, they have no natural resources. They're not like Malaysia. So it's all people power. So they will do a lot of things using people. Their plastic surgery qualification itself is very different from Malaysia. Here you need to be a surgeon and then you need to train to be plastic surgeon. There, after you finish, get your MD, you straight away 3 years training, you get a plastic surgery. So ada banyak plastic surgeon dekat Korea, and they all have to make money lah. Similarly, Thailand also same. Thailand also same. So most of the complication around Southeast Pacific, Southeast Asia areas coming from Thailand is because Thailand rules are quite lax, and they do a lot of things that is not correct lah. I don't go into details about that, but so price may be cheaper a bit, but the problems will be more. Yeah, I'm not saying there are no good doctors. There are good doctors, but if there are good doctors, we are very competitive in pricing. We are not more expensive than them. No, it's just people don't know. They thought outside will be better. And some of them are doing outside because they want to hide.
Stigma,
Huh?
stigma in Malaysia.
There's a stigma, yes. There's a stigma. So people look down on people who are doing things to make themselves better. Everyone knows now that people are doing things for themselves, but they will still hide it. You know, so they want to hide away from people here, so they will go to a neighboring country to do their procedures. And then come back and say, I only do meditation and put baby oil on my face. No, some of our leaders I know doing elsewhere said things like this in the newspaper. Quoting. Yeah, one more question.
Dekat Malaysia ada berapa ramai pakar yang macam doktor?
Ada berapa banyak? I don't know
lah.
Yang ada
Yang certified macam doktor lah.
I don't
Kenalan
have a
doktor.
full but what I can tell you is this lah. When I first opened my centers, this is after all the different trainings I did for different bidan, because cosmetic centers you need different experiences. You need to have dermatology experience. Like what I do, beauty from within, I need functional medicine experience, female health experience, because I'm dealing with female. Sometimes pigmentation is not just pigmentation, it's hormonal problem. So I also need to know about that. So when I open my center, I open it as total wellness specialist center. Is because we are not just doing cosmetic treatment only. So at that time, people doing different things, dermatologists, plastic surgeons, people like us who opened at that time, there was about 10 in the whole of Klang Valley. That time I counted. Now I don't know.
Mungkin ini last question. Saya tertarik dengan risiko.
Yes, we were missing you so much. You didn't ask any question.
So mungkin ini berkaitan dengan psikologi juga. Bila pembedahan kosmetik tidak berjaya, ada yang mengalami depression, kemurungan, dan dia rasa macam tak puas hati. Dan ada juga yang macam benda ni obsession. Sebab bila once you buat sekali, you akan buat lagi. So benda tu mungkin bagi setengah orang okey, tapi bagi setengah orang macam dia ada penyakit benda ni. So dia nak repair, nak redo ni tak puas hati. So mungkin ada certain penerangan yang doktor bagi untuk sebelum buat rawatan ataupun selepas rawatan mungkin tak sukses. Macam mana prosedur tentang psikologi lah.
Yeah, there is a condition called poor body image. Okay, this is a psychiatric or psychological condition lah. So apa saja dia dapat pun dia takkan tengok result. Dia tak boleh tengok result. Dia selalu kena buat lebih. So these are the ones also jumping from one doctor to another. Macam for me, I'm very balanced. If somebody did something and then they say, oh, do this, I will say no. We look at your cellular health, we make you healthier from inside, I will change something else to focus for them. It's different. But poor body image is sometimes quite a difficult thing to notice also. This from my experience, because I wouldn't say I didn't make mistakes, okay? Because I think the person is not psychological, I think the person is very clever, I think they are okay. Tapi after we did only, we realized they are this type. Yes, we have people like that. Then we need to stop doing the treatment for them. But normally I will ask for major changes lah. Bukan anti-penuhan atau laser atau jerawat treatment, no. But if dia nak tukar dia punya nose or their face shape atau body shape, I will ask them the question, what is the reason you're doing this?
Okay.
Kalau dia cakap, oh, my husband dah lari, saya rasa kalau I cantikkan diri, my husband akan kembali. I will tell them that's not going to happen. Yeah, because tak ada kaitan. This lady is terlalu cantik pun husband will lari also, because that's a different condition. There's no connection. But if the patient is sensible, then they're going to say, I just want to feel good about myself. You know, I know my husband has done this to me. I'm not expecting him to come back, but I just want to feel good about myself. And okay. So ada certain soalan lah we pose to the patient just to fish out dia punya intention. Or if the patient is saying, oh, I went there, I was so unhappy. I went there, I was so unhappy. I went there, I was so unhappy. Again, danger sign. Okay, some problem with the person. Unless there's a major complication happen, we understand lah. But even then, I will try to tell them, you go back. Kalau dia doktor yang sah, kita cakap, you go back to the same doctor. Dia tahu apa yang dia buat untuk you. You must go back there. Then some of them say, I went so many times, I cannot solve the problem. Then we need to help because we are doctors. We sign an oath to help other human beings. So we have to accept. So it's a very fine line. But poor body image does exist and it's a psychological problem. Yeah, so it's a good question. So everybody must be more aware of it lah. Even consumer can also think about them. So what is my reason for doing this? Is it to change? Is it to change my circumstances at work? Is it to get a promotion? Maybe not the correct reason. We normally advise people if you're undergoing severe changes in your life. You baru pindah rumah, you baru change husband or wife, or you baru dapat, divorce or something major happening with yourself. Don't approach major cosmetic procedures at this period of time. You have to wait for things to settle before you approach.
Okay, we have time for one more question.
Doctor, what about these things? Beauty center, they offer so many things, treatment. But when I look at this, Dr. Alice can offer facial like a normal facial, right? And then with beauty center, uncertified beautician, no doctor at all. So what do you think when people like that like to go to beauty center and I want them to come here because we can offer more the continuous treatment, right?
Yeah. Proper advice because here we are more professional. So we also train everybody in the center to have a professional approach to our patient. So we will offer better consultation, number one, depending on what they need. And then number two, we also give the assurance to our patients that all our machines, what we do are treatment facials. So all our machines are FDA approved, CE marked products. So we don't use anything that we just buy from, we don't do things like that because we want to safeguard the patient's skin. I mean, many of the beautician, their psychology, the way they talk to the patient is, oh, once a month if you don't come and dig out your this is all psychology. How I know? Because when I was in GH Klang, I had very bad skin. I used to go to many beauticians. That's one of the reason I came to this line. That's one of the reason. And it was all sorts of things they will tell you.
Yeah, it's not cheap.
Yeah, it's not cheap. At that time, I was paying every visit I went in, I was paying 1,200, something like that. Facial product, they will keep adding on. They will say, oh, this one, the respond, you have to add on one more. And then they'll say, oh, this one didn't sort the open pore, I have to add another treatment on top of it. So each one will add on. And then they guilt trip people into thinking that, oh, if you didn't take out, let me to pluck out all the thing will become very serious. Your face will be dirty. Because many of my patients will ask me this now. They ask me, oh, if I didn't go for that kind of pick out facial, my skin won't get dirty. Yeah? I say, no, I've not done a facial on my face for very, very long time. My skin is not dirty because our body has the ability to change over and cleanse itself. Okay, but you need to have a good routine lah. You mesti buang makeup betul-betul. You need to double cleanse your skin. You need to reduce the dryness that comes from makeup or environment with the proper products. All this is important. But we don't do things like picking and poking, because my belief is it will cause more scarring and more open pore. We treat a lot of people for open pore around here just because it's their beautician gave them the gift for all the money they pay to them. So it caused harm to the skin. So here we promise not to do things like that. We are very genuine. We will openly address the problems with the patient. We will tell them what's the problem you have. And then if they did the treatment, we will patiently wait for the result and advise them along the way. And our equipments and our products as well, all are FDA approved or licensed from KKLIU. So these are assurances. Beauticians we know, because on and off we have beauty suppliers come to me and say, oh, this serum is only 3 ringgit for you. But easily every facial you do, you can sell it for 300 ringgit.
Ringgit for you.
I'm like, I will not use products like that. What is it for 3 ringgit you're putting inside there? I'm not sure, I'm not talking about everybody, but I'm not sure how genuine and how interested in people's welfare or skin welfare the beauticians are. If they are, then it's good for the customer. But if they wanted something more, something proper done on their skin, and every facial that we offer have a unique advantage on top of a normal facial. So our facials are called doctor's treatment facials. So there memang ada changes in the skin that we can provide because we are using the kind of products and FDA and CE approved equipment.
Is that your hot selling products?
Huh?
Is that your hot selling product, your treatment?
Treatment facials?
Yeah, so you say doctors.
Yeah, you see now at the moment the trend in Malaysia Puan is people don't walk into a clinic and ask for facials. Most of them will go to a beautician. When they get problems that they couldn't sort out with the beauticians, that is when they come to the doctors. Especially a senior doctor with me, when they cannot find result with other doctors. So it's a bit difficult, but our regulars will always come back to us for facials because they already know our quality. So they will always come back for facials. But what we are trying to do is, we have done a laser treatment for the patient. Kita dah buang dia punya pigment, everything. We don't want the patient to go back into a condition where they will get back all the pigment, So we will always advise our patient to have maintenance facials with us. So even though we say that it is a facial, but there is still some treatment results there. Like some of our facials can reduce the pigmentation. If it's borderline problem, some patients walk in for a consultation, they expect a laser, but I will tell them a laser will not be necessary. You can do the facial. So our facials can also give results. So we are different. Huh?
The anti-aging. Yeah, the anti-aging.
Oh, okay. The anti-aging part of our facial treatments, this is very, very unique. It's many steps, of course. It's about 1.5 hours facial, but it is amazing. Do you want to know about it? Okay. So because we talked about how people all need all the, oil deposits from the pores to be taken out.
Yeah.
So first we start with something called a hydrofacial. So hydrofacial, we are using water jets, micro jets, but ada ubat-ubat juga lah bagi kurang whatever bacteria on the skin, soften the skin cells, remove dead skin, at the same time penetrate deep inside to cleanse the pores. So we do that first. Okay, so after we do that, then we will penetrate our serum inside. This is an anti-aging serum that we penetrate inside, and the penetration goes to deep dermis, and we have clinical study to show how the product can be found after 1 week in the deeper part of the skin, promoting new collagen, everything. So that's our second step. Then after that, we will do a radio frequency, which is a multipolar radio frequency, which is to tighten the skin pores, lift up the skin if loose a bit, So that part of it. Then after that, we are going to do a cool down of the skin because we have penetrated a lot of product. We want the pores to be closed. And then also our cryo cooling method will give that rejuvenation, extra rejuvenation to the skin cell. So we are using a cryo cooling step. Then after that we will do a deeper muscle tightening. It's a massage step, but it is with microcurrent. So when my staff put on the glove, which is of course connected to the machine, and they do the massage on the patient, it's not a normal massage. It's opening up all the saluran darah. It is going down, the energy is going down to the muscle to tighten the muscles. And our skin also has muscles, you know. So we also tighten the muscles of the eccrine muscles of the skin, everything, and then mask. So this is like a total anti-aging facial we offer. So this kind of facial, I don't know how many center can offer. Yes, thank you.